and we may not call it a disease because it is the manifestation. It may be a manifestation of several diseases occurring in bothing, although we are today the course is of ruminants, but we will certainly discuss anemia in every aspects in all types of animals. So this is a common terminology which we have learned from a very long time, that the definition is anemia is defined as an absolute decrease in red cell mass as measured by RBC count, hemoglobin concentration, and PCV. So as the definition indicates, if there is any decrease in the RBC count or the hemoglobin level or the PCV level in any animals, we call it a anemia. Looking, if the anemia, this is the definition, it means the RBC formation, the hemoglobin synthesis, or the reduction in both can lead to decrease in the blood cell mass. So that decrease in the blood cell mass is popularly known as anemia. So the most important thing, from where the anemia develop and what are the etiology for the production of anemia in different animals. So as we know that each and every RBC that is formed in the system has its own lives. Means it is species specific. For example, in human being, it has its own life cycle. After that, it gets destroyed naturally by the reticuloendothelial system. Similarly, in animals also, whatever the RBC is forming, after some time, after their lifespan, it destroyed in the system. So it can develop from loss. From why and where the anemia develop in animals. The most important thing, as most of you are from the department of surgery, where we see the large loss of blood occurs during different surgical condition, or it may occur due to some of the accidental cases. So loss of the blood is one of the primary cause of development of anemia in most of the animals. Now the first, this is the external cause. It may be external loss of blood, or it may be internal loss of blood due to some of the accident, or it may be due to some of the rupture of the blood vessels. Now this is the loss. This is a direct loss of the blood. Now what happens if the blood is forming inside the body and it is destroyed by certain etiological agent? For example, the factor responsible for the destruction of blood in the system, either in the blood vascular system. Okay, so this is also a actually this is the disease condition in which the RBC is destroyed in the blood itself. Or there may be third region, lack of production of RBC. As we all know, the RBC is formed in a very important organ of the body, that is called, where the RBC is formed?
Bone marrow.
Bone marrow. Actually, bone marrow, only in bone marrow, is there any other organ where RBC is formed?
Kidney.
Actually kidney release a factor called erythropoietin. Okay, this is also a good kidney release erythropoietins. It releases erythropoietin, and that erythropoietin trigger the production of RBC from the bone marrow. So this is the factor responsible for the production of RBC. That certainly release erythropoietin. That erythropoietin helps in the production of RBC from the bone marrow. So there is a differentiation point. Suppose I ask a question whether the RBC is formed only in bone marrow or there are other organs also. For example, there is a difference between a neonates animals, a young born animals, and a adult animal. So mostly in adult animals, bone marrow of the long bones are generally responsible, and therefore because we all are clinicians and we think differently. Suppose if an animal is brought to you with a case of a severe accidental, so if there is a loss of bone, there is a loss of bone tissue, bone marrow tissue, in that condition there may be a chance of production of secondary anemia. In that condition also you have to take care that after a long time, because most of the long bones are destroyed by the accident, so there is a chance of development of anemia. So generally in adult animal, the long bones are generally responsible for production of RBC, that is erythropoiesis. So three very important point. This is the definition of anemia. We all know from previous our study, but the three factor is that the anemia is produced either due to loss or due to destruction. We will discuss later on what are the agents responsible for the destruction of RBC in the system. And the third is the lack of production of RBC. That is a very, very dangerous condition. Lack of production of RBC means we will see later on what are the factors that may leads to, that is, we will discuss now the types of anemia, that is regenerative and non-regenerative anemia on this basis. So coming to the classification, the anemia is broadly divided into two, that is, you see regenerative anemia and the non-regenerative anemia. So the most generally the anemia that are produced in the system are mostly regenerative in nature. Either they are produced by the loss of the blood or due to failure of production. No, sorry, or due to some of the etiological gene, they are generally regenerative in nature. But sometimes if suppose
So lack of
lack
of production of RBC में क्या क्या होगा?
अभी आ रहे हैं आगे के स्लाइड में आ रहे हैं लैक ऑफ प्रोडक्शन में. अभी इसलिए हम इसको अभी हमने ब्रॉडली टर्म में ले लिया है. I have divided into two parts, that is regenerative and non-regenerative. We will coming in non-regenerative anemia, in which we will discuss about the lack of production of RBC. Okay. So firstly,
Yes.
we will take up here regenerative anemia. So anemia is broadly divided into regenerative and non-regenerative. So coming, as the name indicates, regenerative, it means it is a favorable condition. If the anemia is produced, the animal is going to produce in new RBC. But in non-regenerative anemia, as the name indicates, there are certain conditions. For example, some of the neoplastic disease, some of the problem, especially in the bone marrow, where the stem cells are becoming absent in nature, or some of the genetical factors are there in which the bone marrow doesn't respond to the erythropoietin production. उसको ट्रिगर नहीं कर सकते, वो स्टेम सेल्स का कोई प्रॉब्लम आएगा जहां से आरबीसी, you know the maturation cycle of the RBC, it is produced from a single cell in the bone marrow, then it gets mature, and then the mature RBC comes out in the system. So there may be some problem in the maturation of RBC also that may leads to non-regenerative anemia. So coming to the first one, that is regenerative anemia, as the definition indicate, in a regenerative anemia, the bone marrow responds. So this is the most important point here. The bone marrow responds appropriately to the decreased red cell mass by increasing RBC production and releasing reticulocytes. Now my question is, what is reticulocytes? Reticulocytes. Here it is written by release of reticulocytes. Anyone? We were discussing
immature RBC, sir.
Immature RBC is reticulocyte. That good answer, because we have seen in mammalian that the RBC has a different stage of development. So in case of emergency, for just you take an example like that, we have a police, we have a defense army person, and we have a home guard also. Okay, so they are differently trained. The most the sophisticated one, the RB, followed by our police, and followed by our, okay, so this is the three lines of defense, as you suppose in our system. So once there is some problem in a city, the police go to counteract. And suppose if a large amount of police force is required, then we have to supplement it from some other, for example, from NCC, from any other source. So the immature one, the NCC person, the home guard, they act as a reticulocyte during an emergency condition. For example, if there is large requirement of immediate requirement of RBC, then in that condition, the immature cell starts coming in the system. So that is an indication of regenerative anemia, and this is the most important point, occurs during emergency condition of blood requirement. Although this is not a very use, because we know the most of the cells RBC are required is non-nucleated in nature. So if the immature RBC is coming in not a red value, but it is an indication that regeneration is going on, means the bone marrow is responding to the decreased number of RBC. So this is a very, very important point. So anemia during hemorrhage and hemolysis, the two very important conditions, we are regularly getting those hemorrhage and hemolysis. So what are the conditions in which we are getting hemorrhage, Rupesh? हेमोरेज होने का बॉडी में क्या क्या कंडीशन मिलते हैं, क्लिनिकल कंडीशन, एनी कंडीशन, पिंकी? ओके, इंजुरी में हेमोरेज होगा. ओके, और हेमोलाइसिस, एनीवन? बिकॉज today most of the surgeons are here, so I will put a stress on this hemorrhage and hemolysis. Hemolysis from medicine person and hemorrhage from surgery one. So what are the other, can you take give an example of hemorrhagic condition? Any hemorrhage? बहुत सा बात करते हैं हम लोग, ब्रेन हैमरेज हो गया, जीआई ट्रैक में हैमरेज हो रहा है, इंटरनल हैमरेज हो रहा है, एक्सटर्नल हैमरेज हो रहा है, ओके। एंड इन हेमोलाइसिस, एनीवन, हेमोलाइसिस कहाँ कैसे होता है, किस किस कंडीशन में बॉडी में हेमोलाइसिस? रप्चर ऑफ आरबीसी इन द सिस्टम, बहुत सारे डिजीज हैं जिसमें होता है, इसलिए हाँ ओके हम लोग यहाँ डिस्कस करेंगे ना। एनीमिया पढ़ाना बहुत बड़ा बात नहीं है, एनीमिया तो सब जानते हैं, लेकिन हमको जानना है कि कौन कौन से कंडीशन होंगे, फैक्टर्स होंगे। हेमोलाइसिस, जस्ट क्विक आंसर बिकॉज़ वी हैव 40 मिनट टाइम ओनली।
सर
एनी कंडीशन? यस,
थैलेरिया हो गया सर, थैलेरिया कंडीशन में, बीवीसी के कंडीशन में।
ओके, इन हेमोप्रोटोजोअल डिजीज, ओके। सो हेमोप्रोटोजोअल डिजीज में हेमोलाइसिस
किनाइन में
इरिलिकोसिस एंड एनी अदर
एनाप्लाज्मोसिस में होता है।
ओके ठीक है। एक इन्होंने बताया कि कुछ हेमोप्रोटोजोअल डिजीज में या रिकेट्सियल डिजीज में हेमोलाइसिस आरबीसी का हो सकता है। एनी अदर कंडीशन, फॉर एग्जांपल सम ऑफ द टॉक्सिसिटी, कैन यू नेम?
यस सर,
कोई टॉक्सिसिटी?
लेड टॉक्सिसिटी में
ओके लेड टॉक्सिसिटी। और बहुत ही फेमस टॉक्सिसिटी है, एनीवन फ्रॉम निकल? तुम रुको अभी और भी टॉक्सिसिटी बहुत इंपॉर्टेंट, जिसमें हेमोलाइसिस होता है बॉडी में। श्वेता, हेमोलाइसिस होने का दूसरा कंडीशन बहुत इंपॉर्टेंट पॉइजनिंग है, कोई विटामिन की कमी में भी होगा।
विटामिन के में सर, विटामिन
सी, वेरी गुड, विटामिन सी इज आल्सो ओके। सी में हेमोरेज होता है फ्रॉम द ब्लीडिंग डिसऑर्डर, विटामिन सी में हेमोरेज होगा। हेमोलाइसिस की बात हम कर रहे थे, तो बहुत अच्छा किसी का आंसर आया, विटामिन के, विटामिन के, यस गुड, ओके, इट्स अ गुड आंसर। सो कमिंग टू द नेक्स्ट स्लाइड, we come across the non-regenerative anemia, okay. We have already seen a regenerative anemia in the bone marrow respond to the decreasing number of RBC, but the just reverse of this is non-regenerative anemia. As the name indicates, non-regeneration means something is not going to respond. So in a non-regenerative anemia, the bone marrow responds inadequately. Initially, it will respond inadequately to the increased need for RBC. So if the amount of RBC is the requirement is more, the bone marrow is not going to supplement that amount of RBC. So this is initially it will be different types of non-regenerative anemia, and if we do not go for the treatment, or sometime it become a neoplastic condition, it will enter into a complete non-regenerative anemia, and that is very, very difficult to treat. So prognosis is very, very poor in that condition. So anemia that are caused by decreased erythropoietin. अभी किसने शायद प्रशंसा ने बताया कि किडनी के बारे में बात किया उन्होंने कि erythropoietin. So just you take the example here, in case of chronic renal failure, आप देखते हैं सबसे ज्यादा केस हम लोग के पास आते हैं chronic renal failure का, वहां पे non regenerative anemia डेवलप हो जाता है, क्योंकि erythropoietin जो कि erythropoiesis कराने के लिए रिस्पॉन्सिबल है, उसके कारण erythropoietin अगर रिलीज नहीं होगा तो वहां वो ट्रिगर नहीं करेगा और वहां से बोन मैरो से आरबीसी का निर्माण बंद हो जाएगा. सो दैट इज अ टाइप ऑफ नॉन रिजेनेरेटिव एनीमिया और an abnormality in bone marrow. Sometimes some abnormalities develop in the bone marrow, or the bone marrow get lost in the due to some of the accidental cases. So in that condition, there is chance of development of non-regenerative anemia. So again, coming to the quick classification, we have seen classification of anemia into regenerative and non-regenerative. Regenerative anemia occur in blood loss or in hemolysis. The blood loss is again of two types, external type and internal type. If the blood loss is occurring inside the body due to any other region, or if the injury is outside, it may be external and internal loss of the blood. Now coming to non-regenerative anemia is again of intramarrow, means the real problem is inside the bone marrow. Bone marrow problem is there, and if it is extramarrow, for example, just we have seen the extramarrow is, the example of extramarrow is loss of erythropoietin production from the kidney. Okay, so जैसे मैंने एक यहाँ पे ग्राफ दिया है, अब देखिए एक स्टेम सेल से किस तरह से एक RBC का formation होता है. This stem cells are present in the bone marrow. So if there is a failure of production of this or conversion, both failure and conversion, as the Sweta was asking, what are the region and how the non-regenerative anemia is produced. So inside the bone marrow, these stem cells are present, and by the message of the loss of the RBC come from the other region, they start producing large number of RBC. They has to produce. But sometimes if there is any problem in this pathway, for example, if the erythropoietin coming from the kidney is not acting on this, and even in this cascade, there is a role of corticosteroid also. So in this two region, if they are not acting on this, this will not be producing the RBC. Or, so this is the region you see here in the stem cell. If there is stem cell become neoplastic or aplastic condition, that is called aplastic condition. So these stem cells are not being converted into different stages of RBC. So there will be failure of production of the real RBC, and this is the cause of the production of non-regenerative anemia. So again, this slide again is a types of revision for the just a quick revision. Regenerative anemia is divided into blood loss and hemolysis. The blood loss of external and internal in nature. And you see the blood loss, again I have divided the blood loss into external and internal. External, you know, the trauma or during surgery or during some external tumor, what the people of surgery are seeing this case, large sometime blood loss during some tumor also. And some of the external parasites, we were talking of the different parasites that are occurring that may lead to external loss. So the trauma, the surgery, the external tumor, and some of the external parasites are responsible for the external loss of the blood. And in internal, again, some of the trauma, if there is internal injury, some of the surgical conditions in which, and the most important point here is coagulopathies. You just, you see this point, coagulopathy. So coagulopathy is very, very important. Gastric ulceration is very important. Internal tumor and internal parasite. So in internal loss of blood, you will see that the trauma, the surgery, and the most important one is coagulopathy and gastric ulceration. Internal tumor is important and internal parasites are important. So can you name me any internal parasites? कोई parasites internal है जिससे बहुत ज्यादा blood loss होता है? Quick, just a undergraduate type of question. Any parasites? प्रशंसा, blood sucking parasites का नाम बताइए जल्दी से.
लीच सर.
Internal parasite, internal. लीच तो बाहर का आ जाएगा ना, external मैंने छोड़ दिया है. I'm just asking, what are the parasites that leads to severe anemia? Internal parasites. In any animal, you can tell me. We are regularly seeing the case of some of the parasites occurring. Outbreak is there in our farm also, in sheep and goat. Anyone? Yes? Hemoncus. Hemoncus contortus is one of the internal parasite that is a heavy blood sucker. Any other? There are so many hookworms names are there, both in ruminants as well as in canine also. Cystosoma, ankylostoma. It is ankylostoma. Ankylostoma caninum. निखिल तुम चश्मा पहन लो, बहुत धूप लग रहा है तुमको छत पे. हेलो निखिल.
हाँ सर, नीचे में नेटवर्क नहीं आता है. यस सर.
बहुत धूप आ रहा है पीछे.
रूम में नेटवर्क नहीं आता है.
चलो ठीक है.
तो ये
okay, we were discussing about the internal parasite that are responsible for the loss of the blood. The most important in case of ruminant is Hemoncus contortus. In case of other ruminant, the hookworms are also, for example, bunostromum is very, the different species of bunostromums are very important. And in case of canine, the ankylostomums are the species that they are the hookworm. They are responsible for sucking large amount of blood. But our concern in our day-to-day clinics is coagulopathy. We are seeing this coagulopathy, means disorder due to blood factors. What are the blood factors? Anyone that are responsible? Coagulopathies is a very important things in case of production of anemia. Anyone? Coagulopathy? Coagulopathy is a type of disease in which there may be loss of some external and internal factor responsible for coagulation of blood. Understand? Coagulopathy कहने का मतलब है कि दो फैक्टर होते हैं बॉडी में. एक इंटरनल फैक्टर होते हैं, जैसे आपने प्रोथ्रोम्बिन और थ्रोम्बिन का नाम सुना होगा. ये एक कैस्केड है जो कि लीवर में सिंथेसाइज होकर के उसको निकलना होता है. ठीक है. अगर इसके में किसी तरह के भी कोई भी फैक्टर का, जैसे आपने वॉन विली ब्रांड फैक्टर, किसी नाम सुना है इस डिजीज का? हीमोफीलिया का तो नाम सुना होगा आप लोग ने. इन ह्यूमन बीइंग हेमोफीलिया, एनीवन? हेमोफीलिया नाम सुना है ना, कि किसी फैक्टर का यहाँ पे कमी हो जाना. फॉर एग्जाम्पल जेनेटिकल डिसऑर्डर. ओके, सो ये सारे फैक्टर को भी ध्यान में रखना होगा कि किसी खास ब्रीड में किसी एक फैक्टर की कमी होगी तो आप इंजेक्शन लगाओगे ना, तो वहां से ब्लड फेंकना शुरू हो जाएगा. कभी गौर करना, कभी ऐसा कंडीशन 100-200 केस देखेंगे. इन वन केस यू कैन कंप्लेन, sir, I am going for intravenous therapy, but there is a formation of hematoma. Most of the surgeon, you are doing a surgery for hematoma. Can you tell me a reason for production of hematoma? Why and how hematoma is produced? अगर आप हेमोटोमा को जाकर के अच्छे से पढ़ेंगे, you will find there might be some of the coagulation defect also. Although most of the hematomas are produced by injury to the longer pendulous ear, वहाँ पे उसको पंजे से मारता है तो वहाँ पे blood accumulate हो जाता है. लेकिन इसके पीछे बहुत सारे दूसरे रीजन भी हो सकते हैं. किसी एक डॉग में हेमाटोमा प्रोड्यूस in the liver. So if the liver of the animal is compromised, you will be getting chance of bleeding disorder. So there might be bleeding from different place of the body. Now, external factor, you all are knowing external factor. They're very, very important external factor. For example, the calcium, the vitamin K. These are some of the external factors. So if the animal is suffering from calcium deficiency or vitamin K deficiency, they are going to suffer from this type of problem, that is coagulation defect problem. And due to that, there is chance of hemorrhage or hemolysis in the body. Now coming to the most important, hemolysis. Again, this hemolysis is immune mediated, or it may be a neoplastic condition, or it may be drug or some of the toxins, or even after vaccination. So this hemolysis problem is again divided into three parts. It is immune mediated, or it may be a neoplastic, or it may be drug induced, or it may be induced by some of the toxins, or sometimes just after vaccinations. So coming to this, I have given here a chart of different causes, different toxic causes of hemolysis. You see some of the drug we have discussed, some of the drugs. For example, in case of acetaminophen, acetaminophen is popularly, which one is acetaminophen? क्या होता है? Acetaminophen कौन से ड्रग बहुत फेमस है मार्केट में? Paracetamol toxicity. Okay, so paracetamol toxicity. So this toxicity is very, very important. Some of the plants we were discussing about, हम यही आंसर चाह रहे थे. Bracken fern poisoning बहुत famous है. Sweet clover poisoning is very, very famous. And the chemical we have discussed, lead chemicals. Again, there are the medicine also. There are long list of medicines. And in plant, you see the onion toxicity, especially in case of ruminants. So this onion, generally you know that onion is not advocated for feeding in case of ruminants. अगर आप ruminant को प्याज खिलाते हैं, that may leads to hemolysis. So this is a very, very important. This may create our toxicity. So beware of onion. Just ask question if the hemolysis is coming in the ruminants. Just ask about the feeding condition and a certain other chemical, for example, selenium, copper, and zinc. So these are some of the etiological agents. Now coming to the immunological reactions, some of the infectious agents, for example, Clostridium and Leptospira. In case of viral equine infectious anemia and feline leukemia virus. And in case of rickettsia, that is Mycoplasma, Anaplasma, and Ehrlichia. And in case of Protozoa, Babesia, Theileria, and Trypanosomes are related for creating hemolysis in the blood. Now coming to the non-regenerative anemia, as we know that this is a very, very poor prognostic condition, and initially it may produce due to some of the deficiency. that leads to production of RBC. For example, there may be deficiency of iron, there may be deficiency of copper in the body, but if that deficiency remains for a very, very long time, the animals enters into non-regenerative form. So non-regenerative anemia is either it is nutritional deficiency initially, then due to certain chronic diseases, or due to third, that is extramedullary, मतलब कि bone marrow के अलावा जो सबसे important factor है, renal disorder. So this is the most important part. Now coming to the nutritional deficiency, the micro minerals that are required for the synthesis of RBC, if they are deficient in the system for a very, very long time, the mature. निखिल तुम्हारा आवाज आ रहा है लग रहा है, थोड़ा म्यूट कर लो उस माइक को. For example, nutritional deficiency, the iron deficiency, as we have discussed, the copper is very, very important. Then vitamin B12 and B6, riboflavin, niacin, vitamin E, and vitamin C. So these are the certain deficiency. If they are for a very, very long time, prolonged period of time, the animals will enter into non-regenerative anemia. Now, in case of chronic diseases, the chronic inflammation, infectious, especially the neoplasia, the liver disorder, the hypoadrenocorticism, and hypothyroidism. So these are the chronic disease in which there is a chance of production of non-regenerative anemia. And the renal cause, the most important cause, is the chronic renal failure. So these are certain diseases that are responsible for production of non-regenerative anemia. Now, what are the clinical signs? I have only 6 minutes time. So lethargy and exercise intolerance, mucous membrane will be pale in color, tachycardia will be there, low grade hemic murmur is there. Time is very, very less. Can I ask what is hemic murmur? Anyone? Hemic murmur? What is murmur, Sweta? Murmur क्या है? कहाँ पे किस organ system से related है? Murmuring sound?
Heart से related है.
Heart से. Very good. It is related with the heart. वहाँ पे क्या होता है रुपेश?
सर TRP वगैरह में सर murmur sound.
हाँ, तो हार्ट में बहुत सारे चैम्बर हैं और भाल्व है, तो ये किसका प्रॉब्लम को इंडिकेट करता है? वाल्वुलर प्रॉब्लम को इंडिकेट करता है या चैम्बर के प्रॉब्लम को इंडिकेट करता है?
Valvular problem.
यस, वेरी गुड. वाल्वुलर प्रॉब्लम, इसको हम ऐसे समझ सकते हैं कि एक छोटे से जगह से अगर तेजी से कोई फ्लूइड गुजर जाए तो एक तरह का एक साउंड सुनाई पड़ेगा. तो अगर भाल्व प्रॉपर्ली वर्क नहीं कर रहा है तो जिस समय डायस्टोल है उस समय ब्लड वहां से रिवर्स कर जाए, रिटर्न हो जाए, तो वो एक मर्मरिंग साउंड सुनाई पड़ेगा. दैट इज वेरी, वेरी इंपॉर्टेंट. सो प्रोमिनेंट फीमोरल पल्स इज देयर, टैकीपेनिया इज देयर, एंड एपिसोड ऑफ कोलैप्स. एनिमल स्टार्ट कोलैप्सिंग, बेहोश हो जाएगा. And in case of hemolytic anemia, along with anemia, you will be getting a clinical sign of jaundice also. So that is also very important. Now coming to pathogenesis, what happens if there is anemia? So there is a reduced oxygen carrying capacity of the blood vessels. So if there is a reduced oxygen carrying capacity of the blood, there will be anemia that leads to tissue anoxia. Means there will be loss of, there will be deficiency of oxygen at the cellular level. So the most of the animals shows fatigue, they're not able to move, not able to bark, and there will be there may be chance of development of cyanosis also. So inadequate tissue oxygen is there. All the clinical signs will depend upon inadequate tissue oxygenation. So the compensatory mechanism develop. If there is a production of anemia, then the compensatory mechanism start working. So when you go for diagnosis, so you have to see the hemoglobin and the PCV level. So both you have to calculate. Only if you are going for hemoglobin concentration, it may be wrong. But if you are going only for PCV, it's again wrong. Because sometimes this RBC level is also related with the amount of fluid in the body. So if the animal is dehydrated, the PCV level will automatically rise. So you have to see the hydration status also. Because once the animal will be dehydrated, the PCV will be automatically elevated. Suppose if the animal is suffering from anemia also and also from dehydration, the PCB level will be normal in that condition. So this is falsely elevated in case of dehydration. So for diagnosis, you have to depends on the clinical sign. You have to see the mucous membrane. Along with that, you have to calculate hemoglobin as well as PCB value. Besides that, we have to see the size and shape of the RBC. When you go for blood smear examination, you will very well appreciate the shape and size of the RBC. For that, we have a red blood cell morphology, the reticulocytes count, the erythrocytic index, and the platelet is also very, very important. So coming to this, you see the level of platelet, we have classified 30 to 37 mild anemia, 20 to 29 moderate anemia. And if the platelet level, PCV level is coming below 20, so this is the platelet level that helps in thinking for certain other method of treating anemia, because once the PCV level is below 15% or below 12%, it is very, very difficult to treat the animal with some of the erythropoietic agent or by any intramuscular injection. For that, you have to decide the we should require, the animal required blood transfusion to saving the life of the animal. So on the basis of morphology, the types of anemia is again divided, and this is also a very, very important slide. For example, in case of acute blood loss, you are getting normocytic, normochromic anemia, and there is no evidence of regeneration for 3 to 4 days initially. So in case of chronic blood loss, there will be hypochromasia, microcytic, iron deficiency anemia. So microcytic hypochromic anemia generally be found in case of mineral deficiency, that is the iron deficiency. In case of hemolytic anemia, we are seeing the spherocytosis. Now, this is a very, very, again, important term in which the shape of the RBC become spherical in nature. That RBC shape is also very, very important. So in case of non-regenerative anemia, normocytic, normochromic anemia. So this it is very important for certain examination point of view, for other factor, because this will help in determining the types of anemia developed. So again, I have given a very important chart of reticulocytes. You have to measure the reticulocytes. It indicates the degree of regeneration. So if you are measuring the reticulocytes count, if you are counting reticulocytes, it will indicate the degree of regeneration, which means the favorable condition or unfavorable condition. For that, we know, we have already learned in pathology the MCV and MCHC level. So mean corpuscular volume and the mean corpuscular hemoglobin concentration is very, very important for determining this erythrocytic index. Now, platelet count is also very, very important. For example, there are certain conditions in which the thrombocyte level decreases. So that is called thrombocytopenia. If the level is below 20,000 per macroliter, it is an indication of severe thrombocytopenia. It means the bleeding is occurring due to certain condition of the platelet disorder. So again, we have to examine, for we are going for diagnosis, because we know there are certain parasite that is responsible for severe sucking of the blood. For that, we have to examine whether the animal is suffering from bookworm infestation or whether the small ruminants is suffering from hemorrhage. For that, you have to go for fecal examination. And if the blood is coming out in the feces and you are not able to determine whether that is the case of melena, so you have to fecal occult blood test we have to do, whether that blackish color of the digested blood is there. So it's also an indication that the blood is oozing out in the GI tract. So severe gastrointestinal bleeding is loss of the blood or loss of the hemoglobin by different methods. So first we have to stabilize the patient. Emergency stabilization of the patient is done. Then we have when we will go for a certain estimation of HB or the PCB. On that basis, we determine whether the hemoglobin is very, very less, especially if the hemoglobin level is at 5 or the PCB is just below 15. Then we decide for blood transfusion, and then we go for a specific treatment. For example, if the animal is suffering from hemoporoidal disease, we have to give anti-hemoporoidal drugs, or if the animal is suffering from deficiency, we have to take care of the different type of deficiency. So coming to the last slide, because in another class I'm discussing about the blood transfusion separately, because this is in your course. So I will discuss broadly in the next class the how and why and where we will go for blood transfusion, what are the indication, what are the contraindication. Just for treatment here, I am giving the example of the blood transfusion. So initially you have to stabilize the patient. We have to decide for blood transfusion, and then we will go for certain specific treatment. In case of blood transfusion, we have to take care of the donor and the recipient animals, the amount of blood to be transfused, कितना खून उसको देना पड़ेगा. इसके लिए PCV का estimation is the most important things, because until and unless the PCV level is below 15 or the 5, the directly giving blood to the animal is not safe. For that we have to take care. For example, we have to go for major and minor cross. I think most of the PG students are doing blood transfusion here. We have to collect blood in a different manner. Actually, I have already shown you a different method of blood transfusion. आप लोगों ने देखा होगा शायद.
Yes, sir.
कितने लोग नहीं देख पाए हैं?
Yes, sir.
हमें लगता है सब देख तो सब लिए हैं. अब हमें तो लगता है 3-4 लोग तो ब्लड ट्रांसफ्यूजन खुद ही करते हैं अब. आई थिंक कौन ब्लड ट्रांसफ्यूजन कर लेता है यहाँ पे?
निखिल के साथ किए हैं सर.
निखिल के साथ एक किए हो. और ये श्वेता ब्लड देखा है ना ब्लड ट्रांसफ्यूजन, या फिर हमें एक्सप्लेन करना होगा? अभी नेक्स्ट क्लास में जब ब्लड ट्रांसफ्यूजन देखें तो ब्लड ट्रांसफ्यूजन के लिए हम स्पेशली अगले क्लास जो है, मेरा अगला क्लास ब्लड ट्रांसफ्यूजन पे ही है, उसमें हम डिस्कस करेंगे डिफरेंट एस्पेक्ट्स को. लेकिन आप लोग ने देखा है, इसको आप डे टू डे लाइफ में अडॉप्ट कर सकते हैं, जिसके सर्टेन प्रिकॉशंस लेने पड़ेंगे. बहुत सारे ऑफ द रिकॉर्ड भी हम लोग ने बात किया था. ये एक गाय के लिए मैंने ब्लड ट्रांसफ्यूजन का पिक्चर लगाया हुआ है, कैटल के लिए ब्लड ट्रांसफ्यूजन का. इसके बाद ये देख रहे हैं कि दोनों एनिमल में, स्मॉल एनिमल्स एंड लार्ज एनिमल दोनों में आप ब्लड ट्रांसफ्यूजन कर सकते हैं. अगर आप पीसीबी कैलकुलेट कर लिए हैं, हेमोग्लोबिन 5 से नीचे है, 15 से नीचे है, just you take the blood bag of the available for the human being, you can collect the blood, and before doing this we have to go for major and minor tests, जिसके बारे में हम विस्तृत से चर्चा करेंगे अगले क्लास में कि किस तरह से हम मेजर टेस्ट करते हैं, माइनर टेस्ट करते हैं. ये करना बहुत ही जरूरी है, क्योंकि ऑल्दो किताब में या रेफरेंस में लिखा होता है कि फर्स्ट ट्रांसफ्यूजन इज सेफ, but it is really first transfusion is 70 to 80% safe, but you don't know any anaphylactic reaction can occur, and owner will say that the doctor, you have not adopted the proper process. So for doing all this, we have to take care of the owner also. We have to get the risk sign before going for blood transfusion. This is just like an organ transplantation, so there is always a chance of reaction in case of, I think someone of yes, someone is asking question. Yes.
Sir, large animals से blood transfusion same process, right? Just like a small animal, or sir any difference?
नहीं, अभी थोड़ा हम खत्म कर लेते हैं, इसके बाद हम क्वेश्चन पे चलते हैं. ये क्वेश्चन रखना, ठीक है? सो ये आप देख रहे हैं स्मॉल एनिमल, लार्ज एनिमल दोनों में ब्लड ट्रांसफ्यूजन कर रहे हैं. इसमें जितना इसके अलावा अभी ब्लड ट्रांसफ्यूजन के बारे में हम अगला क्लास लेंगे, इसमें हम बात करेंगे. इसके अलावा अगर कोई इस तरह का जो हम बात कर रहे थे नॉन रीजनरेटिव एनीमिया का, जहाँ पे हमको लग रहा है कि हम मेडिकेशन दे के एरिथ्रोपोइसिस को हम बढ़ा सकते हैं और उसके बाद वो रिकूप कर सकता है. सो समटाइम वी अडॉप्ट डेकाडोराबुलिन, आपने देखा होगा, हम कभी कभी लगाते हैं यहाँ पे. So there are certain anabolic steroids that help in recovering the patient from non-regenerative anemia initially only. अगर वो लेट हो जाएगा, जब वो प्लास्टिक कंडीशन में चला जाएगा, तो यहाँ बहुत बड़ा इसका रोल नहीं होगा. लेकिन for immediate saving, for stabilizing the patient, we can go for non-relon decadosacetose rate of 1 to 2 mg per kg, or there are stenozolol, or sometime you might have seen the other anabolic steroid we are using in our clinics just to increase the erythropoiesis. Sometimes we go for blood transfusion, but is it necessary that this blood what we have transfused to the animal will help in taking care of the blood for a very, very long time? The body has to produce its own blood. So just to supplement blood, it will help in recovering the patient from anoxia condition. So just it help in rejuvenating the cells. Again, the body has to depend on its own system for the production of RBC, in which the anabolic steroids help. So other treatment are, for example, we are going for astringent. In case of emergency condition, we can go for epinephrine treatment. We have already seen so many cases of nasal bleeding disorder we are getting in our clinics, and we are regularly using epinephrine or adrenaline as an agent to block the ruptured blood vessels. ठीक है ना? ब्लीडिंग डिसऑर्डर के केसेस आते हैं, मैंने अपने पढ़ा भी होगा, 1:10,000 के रेशियो में मिलाया जाता है एपिनेफ्रिन को, और उसको हम नेजल में इंस्टिल करते हैं. सो समटाइम टॉक्सिसिटी, बहुत ही इंपॉर्टेंट टॉक्सिसिटी मिलता है आपको, खास करके रैट पॉइजनिंग का केसेस मिलता है, जानवर गलती से उसको खा लेता है और वहाँ पे ब्लीडिंग डिसऑर्डर शुरू हो जाता है, अनेमिया डेवलप कर जाते हैं। इन दैट कंडीशन विटामिन के थेरेपी इज वेरी वेरी इंपॉर्टेंट। नाउ कैल्शियम थेरेपी, कैल्शियम थेरेपी जनरली हम लोग करते हैं मिल्क फीवर के लिए, ठीक है, लेकिन क्योंकि अभी हम लोग ने कोएगुलोपैथी में देखा कि एक्सटर्नल फैक्टर में कैल्शियम का बहुत ही इंपॉर्टेंट रोल है। So if the animal is suffering from calcium deficiency, mild calcium deficiency, not the severe calcium deficiency in which the animal just after giving birth sit down or make a separate curvature, so that is acute stage of calcium deficiency. But if the generally the dairy cattle that are producing 20 to 20 liters of milk per day, they remain in a minor deficiency of calcium for a long period of time. In that condition, the farmer generally complain that the blood is coming out in the milk. सुना है आपने कि सर ये जो दूध आ रहा है ये लाल रंग का दूध आ रहा है, किसी ने सुना है?
यस सर,
ये बहुत ही कॉमन प्रॉब्लम आएगा, ठीक है ना। किसान का सबसे ज्यादा एक प्रॉब्लम आता है, खास करके जो जर्सी एंड हॉस्टन फ्रीजियन वाले, तो सर अभी दिया बच्चा और अभी दूध के साथ साथ देखिए सर ब्लड भी आ रहा है, और हम लोग तुरंत समझ जाते हैं कि इसको बिना टेस्ट किए कि इसको मेस्टाइटिस होगा, और या फिर कोई सब उसको अंधाधुंध एंटीबायोटिक लगा देता है, पूरा एंटीबायोटिक देने लगता है, उसको लगता है कि इसको मेस्टाइटिस हो गया है। ऑल्दो अगर इसको हम नहीं ट्रीट करते हैं तो एक मेस्टाइटिस के रूप में कन्वर्ट हो जाता है। लेकिन आपको ये सोचना पड़ेगा कि ये कैटल है, अभी इसने बच्चा दिया है, और हमको पता है कोई जरूरी नहीं है कि वो मिल्क फीवर से सफर किया हो, तो अगर मिल्क फीवर से नहीं सफर करता है फिर भी इट रिमेन्स इन ए हाइपोकैल्सेमिक स्टेज, क्योंकि हम उस तरह का सप्लीमेंट उसको नहीं दे पाते हैं। और क्रॉनिक अगर कैल्शियम डिफिशियंसी से एनिमल कुछ दिन तक सफर करते रहेगा तो ब्लीडिंग डिसऑर्डर डेवलप कर जाता है, और खास करके मिल्क से ब्लड आने लगते हैं। तो इस कंडीशन में हमको एक मिल्क का टेस्ट कर लेना चाहिए, इनडायरेक्ट टेस्ट कर लेना चाहिए। फॉर एग्जांपल कोई भी सीएमटी टेस्ट कर लो या इलेक्ट्रिकल कंडक्टिविटी टेस्ट कर लो, इनडायरेक्ट टेस्ट करके ये पता लगा लेना है कि ये मेस्टाइटिस है या नहीं है, बिकॉज मेस्टाइटिस होंगे तो और भी साइन सिम्टम देंगे, मिल्क का फट करके आना, मिल्क का कोगुलेशन हो जाना, इन्फ्लामेशन हो जाना वहाँ पे अडर में, सीवियरली डिक्रीज इन द आउटपुट ऑफ द मिल्क, बहुत सारे ऐसे कंडीशन आएंगे। तो अगर ब्लड आ रहा है तो जस्ट आप ऐसे भी सोच सकते हैं कि कहीं कैल्शियम डिफिशियंसी, सो जस्ट यू स्टार्ट मेडिकेशन विद द कैल्शियम थेरेपी, जस्ट यू सप्लीमेंट द कैटल विद द कैल्शियम एंड समटाइम वी विल एबल टू ट्रीट इफ द एनिमल इज सफरिंग फ्रॉम कैल्शियम डिफिशियंसी। एक और बहुत ही इंपॉर्टेंट बात है, खास करके यहाँ पे बताना है, एक क्लिनिकल एक्सपीरियंस है मेरा। इफ द एनिमल इज सफरिंग फ्रॉम डायरिया फॉर ए वेरी वेरी लॉन्ग टाइम, ठीक है ना, एक कोई गाय है जिसका डायरिया नहीं ठीक हो रहा है, डायरिया नहीं ठीक होने के कारण क्या हो रहा है कि जब वो गाय फिर अगर दूध दे रही है उसके दूध में फिर से खून आ रहा है। अभी क्योंकि हम लोग एनीमिया पढ़े हैं, यहाँ पे हेमोलाइसिस और हेमोरेज के बारे में पढ़े हैं, और विटामिन के से इसका रिलेशनशिप निकाल रहे हैं। स्मॉल एनिमल, एक तो विटामिन के मैंने बताया कि अगर वो रैट पॉइजन खा लिया हो तब वहाँ विटामिन के को ब्लॉक कर देता है, वहां पे हेमोरेज हो जाते हैं। लेकिन डायरिया से क्या रिलेशनशिप होना चाहिए, एनीवन? हाँ, कोई डायरिया से कैसे रिलेशनशिप हो सकता है एनीमिया का? एनीमिया और डायरिया को रिलेटेड है क्या? इलेक्ट्रोलाइट
सर इलेक्ट्रोलाइट इम्बैलेंस होगा ना,
हाँ, तो
फ्लूइड कम होगा सर, तो रेशियो।
हेलो, आपको अभी थोड़ा एक बार जाके देख लीजिएगा, बहुत अच्छा पीपीटी है डॉक्टर सोनम भट्ट का यूनिवर्सिटी वेबसाइट पे, डिफरेंट विटामिन। नाउ यू नो द विटामिन के इज सिंथेसाइज्ड इन द बॉडी, है ना। जिस तरह से आप धूप में बैठते हैं तो विटामिन डी का सिंथेसिस होता है। नाउ नेचुरली दिस विटामिन के इज सिंथेसाइज्ड इन द स्मॉल इंटेस्टाइन, ठीक है, स्मॉल इंटेस्टाइन में बनता है और वहीं से फिर एब्जॉर्ब होता है। अब एक्सटर्नली विटामिन के तो हम ज्यादा सप्लीमेंट करते नहीं हैं, हम फूड सोर्स दे सकते हैं जिससे कि विटामिन के किसी भी रूमिनेंट्स के बॉडी में बन जाता है, उसके जीआई ट्रैक्ट में बनना चाहिए और बन करके एब्जॉर्ब होना चाहिए। अगर कोई एनिमल क्रॉनिक डायरिया से सफर करते रहेगा, आपके पास कंप्लेन आएगा सर ये डायरिया 15 दिन, 20 दिन, 1 महीना, 2-3 महीना से नहीं ठीक हो रहा है, इसका डायरिया ठीक ही नहीं हो रहा है, मींस द एनिमल इज सफरिंग फ्रॉम क्रॉनिक डायरिया। So whatever the vitamin K is synthesized in the small intestine get washed off. विटामिन के बन रहा है, विटामिन के बनने के लिए सबस्ट्रेट चाहिए, विटामिन के को एब्जॉर्प्शन होना चाहिए, लेकिन अगर नॉन एब्जॉर्प्टिव डायरिया हो रहा है, जो डायरिया के कारण जो भी विटामिन के वहां पे बन रहे थे स्मॉल इंटेस्टाइन में, वो डायरिक फीसिस में बाहर निकल जाते हैं. सो इन द लॉन्ग टर्म, due to this diarrhea, there is a deficiency of vitamin K in the animal body. So once there is a deficiency of vitamin K, as we know, vitamin K is very, very important for producing coagulation. So there will be hemolysis from any body, from any region of the body. So this is the reasoning behind that. If the animal is suffering from diarrhea also, there may be hemorrhagic condition. So आप ऐसे भी सोच सकते हैं, कोई डायरिया पेशेंट आया है,
आपका आवाज कट रहा है.
हेलो